Well, hi, my name is María José González. I'm going to talk about pacemaker. The pacemaker is a small unit that helps your heart beat more regularly. It does this with a small electric stimulation that helps control your heartbeat. You can see here a video that teach us where uh, how a pacemaker can be implanted. Your doctor puts the pacemaker under the skin on your chest, just under your collarbone. It's hooked up to your hair with tiny wires. This helps your body get the blood, oxygen, and food that it needs. The battery unit for this step can be worn on our belt.
Very quickly. Regular and ongoing follow-up appointments will ensure that the pacemaker is working well. For more information,
Applications in medicine said that doctors recommend pacemaker for many reasons. The most common reasons are bradycardia and heart block.
Implantable pacemakers and defibrillators are devices that apply electric shocks to maintain the rhythm of the heart and, if necessary, restart it. As the technology improves and the list of treatable conditions grows, the number of devices being implanted is increasing steadily and now exceeds 500,000 a year. The heart is made up of 4 chambers, 2 atria and 2 ventricles. On each side, the atrium is connected to the ventricle by a one-way valve. Blood is pumped as these chambers contract and relax in turn. The beating of a healthy heart is regulated by electrical impulses. The sequence begins as the atria fill with deoxygenated blood from the body on the right and oxygenated blood from the lungs on the left. An electrical signal from the sinoatrial node then causes the atria to contract, forcing blood into the ventricles. The electrical signal is then picked up by the atrioventricular node and directed into the Purkinje fibers in the ventricle walls, causing the ventricles to contract. And the blood is then pumped through the pulmonary valve on the right to the lungs and the aortic valve on the left to the rest of the body.
How does a pacemaker work? A pacemaker uses batteries to send electric signals to your heart to help it to pump the right way. The pacemaker is connected to your heart by one or more wires, tiny electric charge that you can feel move through the wire to your heart. Pacemakers work only when needed. They go on when your heartbeat is too slow, too fast, or irregular. There are also benefits by regulating the heart rhythm. A pacemaker can often eliminate the symptoms of bradycardia. This means individuals often have more energy and less shortness of breath. However, a pacemaker is not a cure. It will not prevent or stop heart disease, nor will it prevent heart attacks.
your doctor has recommended that you receive a permanent pacemaker implanted in your body. But what does that actually mean? The heart is located in the center of the chest, enclosed by the breastbone and rib cage. By contracting in a rhythmic way, it causes the blood in your body to circulate. A normally functioning heart beats at a rate of between 60 and 100 contractions per minute. These contractions are triggered by a small piece of heart tissue called the SA node. The SA node generates a small electrical signal that is transmitted by nerves to the surrounding muscle. These electrical impulses are what cause the heart muscle to contract. In some people, the SA node fails to cause the heart to contract with its normal rhythm, causing an abnormal heartbeat or arrhythmia. The most common form of arrhythmia for which pacemaker surgery is often recommended is bradyarrhythmia, or slow heart rate.
Apart of benefits, we have also risks. Complications from having surgery to implant your pacemaker are uncommon, but could include infection where the pacemaker was implanted, allergic reaction to the dye or anesthesia used during your procedure, swelling, bruising, or bleeding at the generator site, especially if you're taking blood thinners, collapsed lung, puncture of your heart muscle, which can lead to bleeding into the lining pericardium of your heart and may require emergency medical care. Life-threatening complications of pacemaker implantation are rare.
A surgeon will insert a pacemaker into your body if your heart's conduction system, the electrical system that makes your heart beat, is not working properly. The heart is a muscular organ with 4 chambers. Blood collects in the heart's 2 upper chambers, or atria, before filling the 2 lower chambers, or ventricles. When the ventricles contract, blood in the right ventricle is pumped to the lungs, and blood in the left ventricle is pumped to the rest of the body. The heart has a natural pacemaker called the sinoatrial node, or SA node. The pacemaker controls the heart rate by precisely determining when the muscles of the atria and ventricles contract. The electrical signal produced by the SA node reaches the ventricles through a narrow pathway that includes the so-called AV node and bundle branches. Taken together, these pathways are referred to as the conduction system of the heart. Problems with the conduction system can result if the SA node malfunctions, causing the heart to beat too fast, too slow, or irregularly. Alternatively, a blockage in the bundle branches can develop, causing the heart to beat more slowly or irregularly. These problems can be due to heart disease, medications, or cardiac surgery.
Is recommended
Before the
for many
procedure, your
reasons,
blood
but the
and
most
urine
common
will be
reasons are
tested.
radical and
You
heart
will also
blood.
have
Thank you.
x-rays